This episode is proudly sponsored by your personal assistant and Amber L. Contact us today to learn how you can be a part of the vibration experience. Good evening and welcome to Vibration, where we empower individuals to speak their distinct truths, passions, and personal message on a global online stage. I'm your host, Michelle McDonald, passionate foodie, author, and entrepreneur. And tonight, I want to send a special thank you to our show sponsors, your personal assistant and Amber L. Our topic tonight are the ABCs of diabetes and why your food matters. Our first guest is Dr. Janette E. Martin, who has over 30 years of clinical work experience within the mental health, emergency, and cardiac units of the Bahamas and the U.S. as a registered nurse. Her clinical skills led to exploration in other healthcare-related industries, including pharmaceutical sales and group health insurance, specializing in disease management and on-site health and wellness. Natural curiosity, empathy, and discipline are the basis of Dr. Martin's success as a health and wellness expert. Over the years, he has attained a bachelor's degree in biology and theology, a master's in counseling psychology, a doctorate in human behavior, a diploma in medical nutrition therapy, and certificates in obesity and diabetes management. She is currently the Director of Medical and Surgical Weight Loss and Diabetes Chronic Disease Services at Doctors Hospital, and an adjunct lecturer with the University of the People, the first nonprofit, American-accredited, tuition-free online university dedicated to opening access to higher education globally. Jan has developed and facilitated numerous workplace and community health and wellness programs, including the National Insurance Board's Get Well Bahamas, the Bain and Grantstown Community Health and Wellness Program taking shape, and the Bahamas Hotel and Allied Industries Pension Fund Health Program, well on your way. Dr. Martin also volunteers with the Bahamas Red Cross Society, assisting with efforts to improve the lives of those in need. Additionally, she enjoys cooking, yoga, running, and dancing. We are also joined by Dr. Davis-Simmons, who was born in Freeport, Grand Bahama. She completed medical school at the University of the West Indies and specialty training in internal medicine at the University of Maryland in Baltimore, where she served as chief medical resident. She then pursued subspecialty training in endocrinology, diabetes, and metabolism at MedStar Union Hospital, graduating in June 2019. Dr. Davis-Simmons is board certified in internal medicine and endocrinology by the American Board of Internal Medicine. Her interest in diabetes and endocrinology began in her early medical training, spurred by her father's diabetes diagnosis and type 1 diabetes in her 9-year-old niece. She initially watched them struggle in different ways with their diagnoses and management. She knew that if she understood this field, she could make it easier for them and others to successfully maintain their health despite very real challenges. Dr. Davis-Simmons is experienced in providing advanced medical care in the areas of diabetes, thyroid disorders, thyroid ultrasound and biopsy, as well as medical obesity management, pituitary, parathyroid, and adrenal disorders. Her expertise includes the use of diabetes technology, such as insulin pumps and continuous glucose monitors in diabetes management. She is excited to return home to the Bahamas to realize her passion of serving the community that inspired her to pursue a career in endocrinology. Dr. Davis-Simmons is married to her supportive husband, Kino, and they have 3 children. She enjoys spending time with her family, exercising, and watching movies from the golden era. Ladies, doctors, good evening, and thank you for joining us.
Good evening, Michelle. Thank you.
You're welcome. Now, I must say that ever since I put this flyer out and I let persons know that diabetes was the topic tonight, I got a lot of feedback. Persons have been affected by it in different ways, and a lot of persons are really interested to find out as much as they can about treatment, management, and just education overall. So we have a lot of listening ears out there who are eager to learn. It's a pleasure to have two doctors joining us this evening to share their experiences and knowledge on diabetes, a disease that links to food just through the digestion process alone. It's a chronic disease that is commonly heard of in the Bahamas, and we appreciate you being here. Dr. Davis-Simmons, can you share with us what made you follow the path of this subspecialty of endocrinology and diabetes? And Dr. Martin, why was it important for you to include diabetes within your portfolio of disease management and medical services?
Okay, I would like to have Dr. Davis go first.
Okay, thanks. So, Michelle, you kind of alluded to it a bit when you went through my bio. So, in terms of endocrine is usually coupled with diabetes. I'm a hormone doctor, so that's my subspecialty. But as you alluded to, I have a lot of family members with diabetes, and it's an overwhelming problem in the Bahamas and worldwide. So that was one of the major spurring factors for me to go into that field.
Thank you. Thank you for that.
And for me, you said it in my bio as well. My years of nursing, working with patients in the Bahamas, especially with chronic illnesses, and just seeing the progression of the disease of diabetes, the lifestyles we live, and how pre-diabetes and type 2 diabetes could be prevented if we just make some changes in our lifestyle. So meeting Dr. Davis-Simmons when she arrived home a couple years ago, we decided to work together with her patients, and I bring in the education along with her education, and see how we could begin to arrest the pre-diabetes and diabetes in the Bahamas.
Awesome. Thank you. And, this sounds like a great combination, the education and the expertise coming from a certain sector of subspecialty, and then also coming from the area of management, being able to provide your patients with the full package of being able to understand how to handle, but also live a healthier life with diabetes. So as Dr. Davis-Simmons had pointed out, it is something that is prevalent here in the Bahamas, with 1 in 7 Bahamians, 14.3%, being diagnosed with diabetes or are pre-diabetic. While many of them have heard of the term, understanding the disease and its symptoms are not common. Some may not know that food selection directly links to this disease as well, as it naturally breaks down into glucose or sugar. Can you share with us how exactly food connects with diabetes, as well as its symptoms and other health issues that it can lead to?
Okay, thanks, Michelle. So when we talk about risk factors for diabetes, as you alluded to, lifestyle is a big component. So those who have sedentary lifestyle, poor eating habits, so foods high in sugars, simple sugars, sweets. But other risk factors include just having a significant family history. If you have one parent with diabetes, you're at about 20% increased risk of getting diabetes. If you have 2 parents with diabetes, you're at 50%. And then when you couple that with a lifestyle that is driving you to be overweight, obese, and developing other metabolic factors like hypertension, hyperlipidemia, it becomes pretty much a quiet storm for risk factors. Also, as we age, we're at more at risk of diabetes. So it's more prevalent in those who are over 45, those of non-Caucasian ethnicity, which is majority of the patients in the Bahamas. So all of those couple increase your risk. When we talk about food choices, so when we eat food or when we eat carbohydrates or starch, it is broken down into sugar. Insulin is the key that opens the door to let sugar into the cells. And sugar is not necessarily a bad thing. So when we say sugar, glucose, That is the major fuel for the cells. It's the main energy. The issue is when the sugar is sitting in your blood and not moving anywhere. So that's what leads to all of those complications of diabetes, the blindness, the amputations, the kidney failure. It is the sugar sitting in the blood. And why does this happen? Most of our diabetes in the Bahamas is type 2. So that's 90% of our diabetics. And with those who are type 2, it's usually, like I said, due to family history, overweight, obesity, and sedentary lifestyle, with only a small percentage of being type 1. So when we have the obesity, it also causes a lot of insulin resistance. So yeah, their body's making insulin, but the insulin is not working effectively. So the sugar is just sitting there. Also with obesity, your liver starts to make too much sugar. And again, that creates the, as we say, quiet storm of the hyperglycemia. So making good food choices and lowering your starch component can help to lower your blood sugar. It can help you to lose weight. So if you are in the pre-diabetic stage, just changing your diet can prevent you from progressing to diabetes. Just adding in exercise can help you prevent you from progressing to diabetes. And if you already have diabetes, it can help with blood sugar control.
Awesome. Thank you for that information. I think that has given us a great overview of what exactly diabetes is, and also some awesome tips for those who have been diagnosed as pre-diabetic. Just being able to understand that they still have control over getting that diagnosis. So you mentioned having a sedentary lifestyle, how that is a part of being diagnosed with diabetes. During the start of the COVID-19 pandemic, a rise in the diagnosis of diabetes in children was observed. Can you provide more insight into why exactly that may have happened?
So that happened for a few reasons. With the pandemic, kids, again, were more sedentary. So they're in lockdown mode. They're not out playing with their friends. There's a lot more screen time. In the household, there's a lot more eating, a lot more
snacks.
Yeah, parents are stocking up on the unfortunately unhealthy foods. So a lot of the simple sugars, the candies, the cookies, cakes, chips, sodas. So it led to more obesity. So that's what is really driving the increase in diagnosis of type 2 diabetes in kids. It's really obesity.
Yeah, and thank you, because I don't think a lot of persons would have realized that it is getting closer to the level with the children, because we're so familiar with it from an adult level. When we realize that it is affecting our children more than it has before here in our community, it really makes us stop and think about the choices that we're making and consider the health of our loved ones. May not be our children, our godkids, our nieces, our nephews, those that we love, and an understanding that we can make better choices for them and realize just how close to home this can actually hit.
Exactly.
In understanding that our food matters at any age in our life, when it comes to being pre-diabetic or receiving a diabetes diagnosis, what would you say in regard to the concept that food security and sustainable food within a country has an impact on this?
Okay, so I'm going to defer to Dr. Martin on this.
Sure.
Well, food, we all need food to survive. We need food to survive, and so the country needs to have the food available for people. Now, there are many people in the country. When we talk about food sustainability, what we're really speaking to is that a country is able to grow and supply the amount of food that their citizens require in the present and in the future. So it is important that we begin to have our own farms. We do have farmers markets. We do have farms on the family islands. What is important is that we now begin to encourage persons, and the Ministry of Agriculture, as you know, Michelle, is doing this, and other entities are doing it, encouraging persons to grow their own farms in their backyards. And so essentially what food sustainability is that our country, our leaders, our governing bodies need to be able to put us in a position where food is provided for everybody, regardless of their status in life.
In regard to understanding food security, you mentioned that it is something that we should have as a country. Would that have an impact in regard to perhaps the amount of pre-diabetic or persons that are diagnosed with diabetes within that country?
Yeah, that's a very good question, and it would, because if the country isn't providing, if everybody doesn't have access to vegetables and fruits and whole grain foods, the foods that we need to sustain our health and wellness, over time, and persons are choosing the simple carbohydrates, like Dr. Simmons mentioned, the fast food, the sweets, the chips, and they're replacing those foods with whole grain foods, the whole grain breads or the fruits and the vegetables, then of course we're going to see an increase in non-communicable illnesses, specifically prediabetes, high blood pressure. In this case, we're speaking about diabetes and obesity. So yes, so food sustainability is key to reducing some of the non-communicable illnesses in a country. People having access.
Yes. So within a previous discussion of food selection, Dr. Martin had mentioned the glycemic levels of food, which is important in regards to knowing which foods are best for our bodies and overall health. It's also keeping in mind to incorporating the fresh and seasonal produce, as you had mentioned, from our local farmers. Can you explain the glycemic index and how exactly we can identify which foods are best for us based on their levels?
Yes, the glycemic index is simply a number that scientists have placed on carbohydrates, and it really determines how fast or how slowly the carbohydrate, once we eat it, is ingested in the body, and how fast or how slowly it raises the blood sugar. Now, a carbohydrate is made up of three components: starches, sugars, and fiber. Now, the more fibrous that food product you eat, the more slowly the blood sugars will raise, okay? And so you get more benefit from a food that is full of fiber. It's going to raise the blood sugar slowly, thereby not affecting the insulin levels as quickly as, and the blood sugars as quickly as, say, a piece of candy or a chip or a cookie. So when you eat a high glycemic index food, then it's going to affect the blood sugars very quickly. And so you're going to have a quick spike in that blood sugar, thereby affecting your insulin levels very quickly as well. And that's where storage comes in, and the transfer of blood sugar through the cells, which Dr. Davis-Simmons will speak to as well. So the glycemic index is simply a number that scientists put to carbohydrates ranging from 0 to 55. That's a low glycemic index food. From 56 to 70 is a moderately high glycemic index food, and from 71 to 100. But now people need to understand that some vegetables may be in that high glycemic index range, anywhere from 60 to maybe 100, but still be a good vegetable or food product for the body, simply because of its fiber content. Take, for instance, brown rice. You'll find brown rice on the list of moderately to high fiber glycemic index foods, but brown rice is high in fiber, okay? And so we have to look at those foods, and that's why it's important for diabetics, once they're diagnosed, to see someone who's a medical nutrition therapist or a dietitian who can look at the food, who can help you and guide you through creating meal plans and creating the amount of, looking at the amount of carbohydrates that you require based on what your physician, in this case, Dr. Davis-Simmons, would diagnose you as. So for type 2 diabetics, we want to, and for type 1 diabetics, we really want to look at the amount of carbohydrate intake in each meal and then at the end of the day. And recent statistics from the American Diabetes Association recommend carbohydrate intake of about anywhere from 30 to 60 grams of carbs per day. That averages about 15% of your meal, each meal, with carbohydrates. So you may end up with about anywhere from 40 to 60 grams of carbs per day. And those are recent numbers that they've determined that would affect the hemoglobin A1C number average. Am I correct, doctor?
That is correct. So the numbers that Jan was alluding to, I mean, so the ADA, so American Diabetes Association, especially for our overweight and obese individuals with type 2, they are recommending that patients embrace a lower carb diet. And so that means that to less than 20% of your calorie intake is coming from carbs. If you're overweight or obese. If you're a lean type 2, so you're not overweight or obese, even up to 50% or 45% of the diet. So it really just depends on where you are in the BMI. And by making changes to this diet and decreasing the carbs really has a direct impact on lowering your blood sugars.
Thank you for that. Now, there's one thing that you mentioned, I'm sure a lot of us can relate to. You had stated that the high glycemic foods are the ones that give us that sugar spike.
Yes.
I know many of us have eaten something, whether it's been our favorite ice cream or candy or even a soda, where instantly we kind of felt that rush. Do you know what I mean? And unfortunately, after that, sometimes we tend to feel that crash as well. And so that it gives you the indicator that this isn't something you should be having on a regular basis. You know what I mean? If you're thinking about being healthy and avoiding diabetes and just looking out for your body overall, you know. Mm-hmm. So I appreciate that. Thank you.
You're welcome.
So one important thing, it is all about balance. One of the greatest and healthiest lifestyle changes we can make for our health is selecting the right foods and being mindful of plate portions. Dr. Martin, can you give us an overview of what a balanced plate looks like when it comes to managing diabetes?
When we're looking at diabetes or managing diabetes, we're looking to have the standard half of your 8 to 9 inch plate with fruit, with vegetables. And as I mentioned before, we're looking for the low glycemic index vegetables. Those are the leafy greens, the cabbage, the lettuce, spinach, kale, all the leafy greens. They are lower in carbs, but higher in lower in the starchy carbs and higher in fiber. So you're looking for half of your plate with at least 2 to 3 types of vegetables. The other quarter of your plate, you can either put brown rice or a half a cup of starchier carbs, and that can be potatoes. And we recommend the sweet potato, and that's the American yams, because studies have shown that it really is lower in glycemic index as it relates to the fiber content. Or pasta, if you're looking for pasta, you want to go with the whole grain because you get more fiber, so it won't affect your blood sugar levels and spike it as quickly as the white flour pasta or white rice. And then the other quarter of your plate, you want your protein. Now, protein are not carbs, but we could make protein carbs if we bread it. So you want your protein to be baked, boiled, broiled, or grilled with very little sauce. And we encourage persons to make maybe the other quarter of that plate, instead of rice or potatoes, you can put beans. Beans and lentils are high in iron. They're also a form of protein, and it is a good carb because it is high in fiber. And so 1/4 of the plate can be just beans or lentils. The other half of the plate, simply vegetables, your choice of low starch vegetables, and then protein that is baked, boiled, broiled, or grilled. And we're looking more for fish and chicken, less of the red meat.
Okay. I really like a lot of the pointers that you mentioned. So a lot of us love our fried food. You know, we want to get our thigh snack. We're even thinking about getting like coconut shrimp, things like that that we really like. But as you mentioned, these things have breading and coating. And so we change it from just being a pure source of protein that we can place on our balanced plate into now something that's a carb, right?
Yes.
And we're still trying to ensure that our plate is balanced and we're getting the best out of the foods that we have. So it's just now keeping in mind to have those things very minimal.
Yes,
Additionally,
certainly.
you mentioned having starch. So now instead of just white rice, we can think about quinoa, couscous, brown rice, as you mentioned, has a lot of fiber into it. And also those leafy vegetables. I really like kale, spinach. A lot of persons like those in their smoothies. And so now we realize we can incorporate these into our meal plans and be better prepared.
Yes, certainly, certainly. And those types of vegetables, they fill you up quicker, and because of the fiber in those vegetables, and they keep you full longer without spiking your blood sugars.
Which is very good because at the end of the day, we want our food to look good, taste good, but also be satisfying. So it's very important to know it's going to fill us up and be very good for our digestion at the same time.
That's right.
So one of Dr. Martin's coined phrases is energy in, energy out. And I couldn't agree more. Despite the differences within the types of diabetes, three things are still essential to treating them: education, healthy eating, and physical activity. Can you share with us why these three factors are key when it comes to improved diabetic health?
Well, those factors are key because, one, when we look at the food choices, low glycemic food index food choices, when we choose those foods from our barrel, we're in the Bahamas. We have persons that would always comment and talk about not being, mention not being able to afford all of the lettuce, the romaine lettuce, and other fruits and vegetables. I certainly send them to the Bahamian food barrel because we do grow cabbages. We grow cabbages, purple cabbage, which is high in iron, high in fiber. It is a leafy vegetable. It is a low glycemic vegetable. We also grow other greens here in the Bahamas. We have spinach growing on vines. And our spinach is very nutritious. It's high in iron, and it's also high in other vitamins. We also have here in the Bahamas growing a lot of fruits, and the fruits are high in iron and fiber as well. We have mangoes, we have sapodillies during this time. We have, what else do we have? We have watermelons growing. We have different types of cassava and potatoes growing. So we can make up a healthy diet using our food pyramid, in this case, our food drum. Look for the lower glycemic vegetables, look for the lower glycemic fruits. Now, I'm not suggesting that we pass up the mangoes. What I'm really suggesting is that we look at portions, because that is important. That's the energy in. And so if we're sitting down and eating 4 and 5 or 6 mangoes in one setting, whether that mango is good for you or not, our blood sugars are spiking during that time. If we sit down and eat more than one dilly in one sitting, it's going to spike our blood sugars, because it is the natural sugars that also affect our blood sugars. And so energy in, energy out is extremely important. When we choose the low glycemic index foods, fruits and vegetables on a regular basis, what it does is it improves our blood sugars, our daily blood sugar levels, which then affects our average HbA1c, hemoglobin A1c levels over a period of time. It also decreases our cholesterol levels, because if we're choosing the low glycemic, it's high in fiber, And fiber, as we know, also helps to reduce our total cholesterol. And so it's improving our overall blood sugar levels. And so that's the energy in with the food. Now, when we look at energy out, we're looking at movement. According to American Diabetes Association and the American Sports Association, we should be moving our bodies at least 150 minutes per week. That is an average of 30 minutes, 5 days a week, not missing 2 consecutive days. Now, why they ask that? It's because the more consistent you are, then the more benefit you will receive as it relates to your blood sugar levels, your blood pressure, and your blood cholesterol levels reducing. And so another aspect is education. Diabetes education is extremely important once someone goes to a person like Dr. Davis-Simmons and they're diagnosed with prediabetes. They come in and they receive that education. Education is the stone. It is the key to maintaining your blood sugars. It is the key to reducing your blood sugars, because as a diabetes educator, we teach you about foods, what foods do to the body. We work with you with your medication. The doctor would have probably ordered some medication. We help you to understand that education. We also teach you about foot care and eye care, because as Dr. Wood have mentioned, diabetes it targets every system in the body. And so as an educator, we educate you on all aspects of the disease on a level that you can understand. And so education, healthy eating, and exercise, they are the key tools to reducing those numbers and keeping them down, and possibly even reversing prediabetes and type 2 diabetes.
Thank you for that. And I love the illustration with the goat skin drum. We can all relate to that here in the Bahamas. It is a huge aspect of the Junkanoo, which is a part of the Bahamian culture, our history. We love it, we enjoy it, and so this is something that we can all relate to. And this, of course, helps us to better understand how these 3 things work together: the education, the healthy eating, the selecting the right foods, and also being able to create a source of lifestyle management that works for all of us, no matter whether we are pre-diabetic or if we have received a diabetes diagnosis. We understand that these 3 things can work together to benefit us overall. So lastly, prevention is better than cure. Most people are pre-diabetic, 1 in every 3 persons, and are not aware of it. Dr. Davis-Simmons, what are 4 key indicators of pre-diabetes, and how can we redirect our health in a positive direction?
So at prediabetes, as you alluded, most people don't know they have it because there's not a lot of symptoms. So it's usually detected on a kind of annual visit where the A1C, which is a marker, a blood test that looks at your average blood sugar for the past 3 months. So it's usually picked up on that, where a patient would have an elevated A1C. So it's not high enough to be diagnosed with diabetes, but it's definitely not normal. So that means an A1C of 5.7 to about 6.4 is prediabetes. So there's not a lot of symptoms. So patients are not going to have all of that increased thirst, urination, weight loss that you can have with more overt diabetes or severe diabetes. So there's not a lot of symptoms. So this is why we move into kind of prevention. You're going and seeing if you have high risk factors, family history of you're obese, you have high blood pressure, you have high cholesterol, your doctor should be screening for diabetes on an annual basis. And that's when it's going to be picked up. So it's moving towards preventative care instead of just going to the physician when I have a cough, cold, or I'm sick. And if we talk about prevention, there's lots of studies that hallmark that making lifestyle changes can prevent diabetes. One of them was the DPP study, which is the Diabetes Prevention Program. So they looked at individuals who had prediabetes. They put them on lifestyle management. So they decreased the amount of carbohydrates they're taking in or starch they're taking in. They got them moving that 150 minutes per week. That's where that came from, that recommendation from that study. study,
Nice.
and have them lose 7.5% of their body weight. And by doing that, their numbers went back to normal. So you can prevent it. When we look at lifestyle, if you are overweight or obese and you lose 20% of your body weight through lifestyle measures, you can reverse diabetes altogether, where it goes away and you no longer need medications. So there's definitely prevention. But in terms of prediabetes, there's not a lot of classic symptoms, and that's why getting screened annually is appropriate, especially in our culture and in our environment where it's so high and pervasive.
Yes, and that is a very, very good point. We can add that to our list of tests when it comes to getting our annuals done. It's not something that a lot of us think about, especially if we're not familiar with our own family history. We may not even know that it exists. And so we don't think about getting tested for it. And then if we do receive the diagnosis, that is when we actually find out, well, okay, this runs in the family. I need to understand how to better track this now. And then if I am going to have a family or I already have one, there are ways that I can look out for my family members as well.
Exactly.
So Dr. Martin and Dr. Davis-Simmons, we thank you for sharing the fundamentals of diabetes and how closely it links to the food we select and eat. Through your messages, we now understand not only which foods within the glycemic index we should eat daily, but also how to know if we are pre-diabetic and how to manage the disease if we receive a diagnosis. One of the biggest takeaways is that it's all about balanced, improved health is possible, and we can be an active part of making those decisions. Dr. Davis-Simmons, your journey to diabetes within the medical field is a personal one, and I thank you for your transparency and using that as a driving force to help others, especially those within the Bahamas. Dr. Martin, you continue to guide and motivate others with managing their diseases, including diabetes, with a holistic approach, for which I applaud you. To connect with Dr. Martin on diabetes management, you can contact her at 242-302-3256 and 242-816-7660. To connect with Dr. Davis-Simmons regarding diabetes from an internal medicine and endocrine perspective, you can call 242-302-3250 on Mondays, 242-702-9310 on Tuesdays and Thursdays, as well as 242-328-1119 on Wednesdays and Fridays. As a reminder, this episode is proudly sponsored by your personal assistant and Amber L. A special thank you to our audience for watching and to our guest speakers, Dr. Martin and Dr. Davis-Simmons, for their dedication to providing hope, education, and guidance to a healthier lifestyle for those with diabetes. If you've missed the first half of the show, you can watch the full episode on this Facebook page as well as YouTube. And I also ask persons to leave a heart in the comments if you're watching the replay. I invite you all to follow me for show updates and tune in next week for another episode of Vibration, where we raise your frequency and amplify your truth. Bye, everyone.
Bye. Have a good
Bye.
evening.